Hello, my name is Karcf, and today I'm going to discuss the disease cystic fibrosis and some of the many challenges that these patients face when trying to pay for all the treatments that they need in order to keep an improved health status. Before going directly to the challenges of cystic fibrosis, I'm going to discuss a little bit more of the background and the treatments that are required so that you have a better understanding of the challenge that these patients face. According to the Cystic Fibrosis Foundation website, cystic fibrosis is the most common genetic disease in the United States, affecting around 30,000 Americans. Globally, it affects around 70,000 people. Over the past couple decades, the survival rates for cystic fibrosis patients have improved dramatically. 2 or 3 decades ago, these patients didn't make it. Many times these patients didn't make it until their 10th birthday. But now, with improved treatment and advanced technology, many times these patients can live up to 37 years of age. So basically, in cystic fibrosis, the CFTR gene that is responsible for regulating the transport of ions between membranes becomes mutated, and it causes there to be a malregulation of the way the ions are transported. And so in cystic fibrosis, their ion levels are very abnormal compared to someone who didn't have cystic fibrosis. Even though the CFTR gene is just one little gene, there can be 1,000 different mutations, all leading to some form of cystic fibrosis. The most common mutation is delta F508, and it makes up 90% of the cases. Cystic fibrosis, because it causes there to be a malregulation of the way ions are transported, it causes their mucus and their secretions to be thick and viscous. And so it affects every body system that has any type of secretion. The respiratory system, the digestive tract, and even the reproductive system are all affected by it. However, the respiratory system is the one that is most affected and will have the majority of the symptoms and will even have a greater loss of life. The highest priority in treating a cystic fibrosis patient is making sure that their infections are kept minimal. With the mucus that these patients have accumulated in their airways, it provides the perfect breeding ground for several different types of infections: bacterial, viral, and fungal. To name a few of the infections that these patients frequently encounter are Staphylococcus aureus, Mycobacterium, Pseudomonas aeruginosa, and Burkholderia capacia. Those are just a few of the many infections that a patient may have. So the biggest priority in treating a patient is to prevent the number of infections that they have, or to make sure that they have rapid treatment and that they are able to fight these infections quick so as not to cause a decline in their pulmonary function. Treatment is based on several different angles that are all targeted to preventing the patient from having infection. There are many different types of drugs that are used, such as anti-infectives that are used to prevent the patient from getting the infection. There are mucoactive drugs that are used to break down the mucus, and there are airway clearance therapies that are employed to help the patient expectorate more of the mucus so that they could free their airways of the thick mucus. One of the antibiotics that we frequently use is tobramycin. Tobramycin is used to prevent the infection of Pseudomonas aeruginosa, and studies show that when patients use tobramycin, they have delayed disease progression and actually improved pulmonary function. Another type of category that we use are mucoactive drugs, which, like I said earlier, breaks down mucus. And so when the mucus becomes more thinned, the patient's able to cough it out, and their airways become clear. One of the mucoactive agents that we frequently use is pulmozyme. Pulmozyme, also known as Dornase alpha, works by breaking down the mucus. Studies show that when Dornase alpha is employed in their drug regimen, there is a 27% reduction in the number of pulmonary exacerbations that these patients experience, and there's actually a 6% improvement in lung function. So Dornase alpha and tobramycin are just two of the many drugs that a patient may use in their drug regimen to prevent infection. Another type of therapy that is commonly employed is airway clearance therapy. Airway clearance therapy works to remove the mucus, and sometimes it helps by thinning the mucus out, and sometimes it is used to teach your patients how to effectively cough to remove the mucus. The number of modalities in airway clearance therapy are too numerous to discuss here, but a couple of the ones that are commonly used is PEP therapy. And PEP therapy, what it does is it involves a device that the patient breathes into, and when they breathe into it, it causes their airways to vibrate, and it breaks up the mucus so that the patient makes it easier to cough. Another device that is frequently used is a high-frequency chest wall oscillator vest. And what it does is the patient puts on this vest, which is connected to a machine, and it delivers high-frequency little bursts of gas within the vest and then withdraws it really quickly to make a type of oscillatory motion against the patient's thorax. Studies show that when the vest is used, there's actually an inpatient admissions are lowered by 21%. And the length of time that the patients are actually in a hospital are lowered by 38%. So all of these therapies and technology that I've talked about are very expensive. The annual cost of a cystic fibrosis patient is approximately $15,000, and the costs add up to equal a lifetime average of $300,000. In the past, it used to be very difficult for patients to get insurance, but now with the new healthcare system that was recently implemented, there have been great strides in the patient's ability to receive insurance. Yet, even though it is easier for the patients to receive insurance, there are still many gaps in where there are many patients that still have a great challenge when trying to figure out how they're supposed to pay for all of these treatments. So for some patients, they don't have insurance because the monthly costs are too high. And for others who do have insurance, there is just inadequate coverage for many of the therapies that they require. Studies show that half of the patients pay more than $300 per month in insurance premiums, while 26% are paying more than $500. In addition, over half of cystic fibrosis patients pay around $200 or more on out-of-pocket cost for medication that is needed in their regimen, while 21% spend over $400. The biggest problem with that is these numbers have increased from 2013, and the patient's worry is it going to continue to increase. In addition, insurance, even for patients who do have insurance, there are many therapies that are not covered. For example, the vest that was talked about cost $20,000, and even though all of the studies show the value in the patient using this, some insurance companies refuse to cover it. The PEP therapy, the acapella, and the flutter devices that are used for it cost $50, and once again, some insurance companies refuse to pay that cost. Another problematic issue is the use of patients having to use nutritional supplements and vitamins in order to keep an appropriate weight. For example, Peptamen, which is 1.5 complete HC, costs $300 for 24 cans. 100 tablets of Prevacid is $1,000. These are just two examples of supplements that patients require, yet insurance companies refuse to pay at all. The last therapy that I'll talk about, in which insurance does not cover, has become a very controversial issue in the cystic fibrosis population. Kalydeco, a drug that targets a mutated gene, would treat the majority of the symptoms in this specific gene group mutation. This mutation, although it only affects 4% of the cystic fibrosis population, the Kalydeco patients who took Kalydeco were 55% less likely to have a pulmonary exacerbation. In addition, patients who took Kalydeco also had improved lung function over 10%. Even with such evidence, insurance companies still refuse to not pay the $300,000 a year that it costs for a patient to be able to take Kalydeco. Another problem is there's not a generic form of it, and so patients can't even opt to take a cheaper form. For that reason, many lawsuits have been filed towards insurance companies by patients because they want their companies to cover Kalydeco. Because for these patients who are qualified to take this drug, they are just looking for an answer that would cure many of the symptoms that they experience on a day-to-day life. And because insurance companies refuse to pay, they become frustrated because they just want an answer and relief from all these symptoms. There are many consequences that are associated with patients refusing their treatment due to cost. The decision to skip a treatment is one that has the potential to end a patient's life. Every time a treatment is skipped, it increases the risk of a patient being exposed to a new pulmonary infection, one that could potentially lead them to the hospital. According to the study conducted by the Cystic Fibrosis Foundation website, almost a quarter of cystic fibrosis patients have either delayed receiving medical care or skipped a treatment due to cost. Many of the vital therapies that are needed for cystic fibrosis patients are very expensive. And without proper insurance, patients are going to have to choose between taking a treatment and making sure that their lung function stays steady, or choosing to go without and putting themselves in harm's way. This problem is going to continue to harm and burden the cystic fibrosis population until some solution is found. Whether that means that doctors and insurance companies need to work more closely together in order to educate each other about the cost of these treatments, and doctors need to educate insurance companies about the value of these treatments. That's just one solution. Until then, this is going to continue to be a problem. Thank you.